This is HRB Red Alert, bugs versus drugs, antibiotics and farming.
So if you were a bug, what would you do if you saw something that was about to kill you? You'd try and stop it killing you, wouldn't you?
Yeah.
So you'd try and either stop it attaching to you, or else if it gets into you, you'd kick it out. And that's essentially what antibiotic resistance is. And it makes sense because all these bacteria have been around for billions of years and they're natural survivors.
Where are we in terms of antibiotic resistance in Ireland?
So to give you some statistics, at the moment, less than 20% of our bloodstream infections due to the SA Staph aureus are due to MRSA, and that's compared to about 40% 10 years ago. But now we're seeing much more of the other types of antibiotic resistance. And that's very similar. When we look at the map of Europe, we're very similar to lots of other countries. Lots of countries have seen less MRSA, but more and more of the other bugs. And then lastly, if you map the amount of antibiotics that are used in a country to the amount of antibiotic resistance in a country, guess what happens? It matches up.
In the practice that I work in, and we think we have reasonable prescribing patterns, the resistance to trimethoprim is now above 20%, and there's no doubt that there is increasing resistance to some of these first-line agents. We're not quite at Southern European levels, but we're not as good neighbours as Norway or Sweden are. We're high prescribers of antibiotics. Probably the best data comes from the medical card system, which now covers about 40% of the population. And for children below the age of 15, for every 1,000 children, we have 500 antibiotic prescriptions a year, which is on the high side in Europe. For the adult population, we have 1,500 prescriptions for every 1,000 patients.
What?
So that sounds a lot, and it is a lot.
We took antibiotics for granted for a very long time because they worked so well. They fixed that problem of infectious disease that people used to die of. Our grandparents and great-grandparents, used to die if they scratched themselves, if they cut themselves. Once we got antibiotics, we got these miracle cures, and we just kept using them up as though we would always have miracle cures. And when one drug ran out, when penicillin ran out, we came up with methicillin. That's the M in MRSA. When methicillin ran out, we came up with the extended spectrum beta-lactams, the ESBLs.
GPs are very aware of the issue, but at every consultation there's a doctor and a patient. And as we've discussed a little bit earlier, I think patients' attitudes have changed and are exponentially changing now. But it's like all complex issues or a wicked problem in marketing things. There's not going to be one silver bullet. There's going to have to be lots of different actions done which are going to nudge everybody and the problem to correction.
The latest estimate by a project that was just completed in England that looks at antibiotic resistance globally estimates that every year there are 700,000 deaths from antibiotic resistance around the globe, and also predicts that if we don't get it under control, by the year 2050, which is not all that far away, the death rate could be 10 million. That's one person, one death every 3 seconds all around the world from antibiotic resistance. So,
which is enormous.
Which is absurdly large, right? It's almost unimaginable.
We're talking about antibiotic resistance, but it's also important to remember antibiotics are life-saving. So if you do have a bacterial infection, these are good drugs to take.
Yeah.
So it's important to challenge and to query, but I'd be very anxious to get the message out that these are very useful drugs that save lives.
Yeah.
And when we're talking about resistance, and even if I'm saying like 40% resistance, that means 60% isn't resistant.
And I think Finland is a very good example. They looked at particular resistance patterns to a streptococcus bug, which is a very common bug causing a lot of difficulties, and they changed their prescribing patterns. And what's really good is their resistance didn't just stop, but it went backwards as well, which is really, really important. So it can be done.
How are farms involved in this at all?
So this goes back to the very beginning of the antibiotic era. Right around the time that we were discovering that antibiotics worked so well to cure infections in humans, some bright boy chemist discovered at the same time that if you gave antibiotics to meat animals, chickens, pigs, cows, they would get fat faster. Not actually with fat, but they'd put on muscle faster, and it's muscle that we eat, right? So that started really factory farming. That started the attitude that we could move animals more quickly through agricultural production.
So-
That doesn't exist in the European Union anymore. The European Union banned it in 2006. But it's still widespread in the United States. We're arguing over it. It's huge in South America and in Asia. But we use around the world so many antibiotics, such large volumes, to prevent animals getting ill. If we did that in humans, we'd say it was an appropriate use. And out of all those uses come antibiotic-resistant bacteria in the systems of the animals that we're raising. And that preventive use of antibiotics is still, that's prevalent all over the world, including in the EU.
Do you believe there will be a situation in 20 years' time where people may die from, cuts to their hand or, simple infections? Do you see that as being likely, or is it almost too sci-fi?
No, if we don't
reality?
do something now, it will happen. And we're seeing very small number of patients with almost untreatable infection. So recently I was consulted about somebody that had a very resistant bug in their blood, and the only thing I could use was colistin. There was no other antibiotic left. And thankfully that person did very well, thankfully. But I only had one antibiotic to choose.
There hasn't been a new antibiotic since 1980 something?
Yeah, since 2000, yeah.
2000, okay.
Yeah.
So why is that a problem?
Certainly from a pharmaceutical company's perspective, at the moment, it just doesn't make economic sense to spend 10 years and put millions into a drug that you're not going to get millions back.
The same way that society has decided to have a carbon tax because we all agree that it's so important, as a society maybe we need to realise that antimicrobial resistance is a common good that we should put a price on and encourage pharmaceutical companies with extra funding abilities for that. Because as a society we've recognised that global warming is a huge issue and we're willing to pay a tax for it. If the projections that Maryn has outlined come to pass, it will be equivalent.
Drug compliance, so the patient taking a drug as they're supposed to take it, is at approximately 50%. So if a doctor just prescribes you a certain type of a drug, half of you will actually take it the way you're supposed to. And of course we've seen with antibiotics that's an absolute nightmare.
What we know is that if you don't finish your course of antibiotics, your chances of getting resistance are going to be markedly increased. So it's trying to get those behavioural change messages across, and where people have used people with expertise in how to change patient behaviour, their interventions have worked better as well.
In the Netherlands, they participated in farming. They participated in the EU ban and growth promoters in 2006. And then they noticed they were still having a really high rate of antibiotic resistance to particular drugs. And they figured out it was because of the use of preventive antibiotics in farming. And maybe this is a Northern European consultative thing, they got the Ministry of Agriculture and the veterinarians and the farmers all got together and they agreed, not in a ban kind of way, but in a mutual agreement kind of way, that they were going to try to mutually cut the use of antibiotics on their farms. And they cut it by 50% in 3 years. So there's something about, I think, agreeing to a social compact and to feeling kind of mutual responsibility.
As a society, we like cheap meat. I know enough about farming to know you can only get cheap meat from intensive farming. And intensive farming means you have to use antibiotics or your whole herd is wiped out. So I think it's not just the farmers as well. It's also us. We have to decide, well, actually, what are we willing to pay for and what are we not? So that if the farmers stop using antibiotics, the price of meat that we like eating every day is going to have to go up unless they have a different solution.
The power of consumers to insist on change
Yeah.
is enormous. So in the United States, we have a terrible reputation for factory farming, but consumers said to the companies, we want to change what we buy. And over the past couple of years, McDonald's, Walmart, Cargill, all the major retailers all created antibiotic-free markets, not waiting for government action, but because people showed them that when they spent their dollars, they were voting for something better. There's a chicken company in the United States that feeds its chickens oregano because oregano oil is a natural antiseptic. And they've been able to cut their antibiotic use really significantly as a result.
I hope you will leave more informed and possibly more empowered and hopefully a little bit entertained. Thank you very much.
Thank you.